right, good afternoon, everyone. Thank you so much for taking your time today to attend this webinar. Hopefully it'll be a good use of your time. We have, excuse me, this webinar is slated for an hour, but it generally lasts about 30 minutes because the reporting under 1094 and 1095B regarding what we call minimum essential coverage is a lot less sophisticated than the reporting for applicable large employers. So I would like to say, if you are an applicable large employer, you would be filing a different form. So this presentation is for companies that are not applicable large employers and actually sponsor self-insured plans. So with that, a couple of housekeeping items. We generally record the webinar, and I do send the slides after the webinar. So we also try to keep questions until the end. You can feel free to put them in the chat box or the questions box, and we'll get to them right before we end the presentation. So with that, we always have our legal stuff. You know that I'm not an accountant, I'm not a CPA, and so there sometimes are things that come up that may require that, and we would certainly welcome to refer you to anyone we knew or thought could help you. And again, this presentation is intended for employers with self-insured plans for 1 or more months in 2022 that are not applicable large employers under ACA. And if you're an applicable large employer, I'm sure you know what I'm talking about, that's a completely different set of forms. So with that, let's go forward. We're talking about filing the 22-year forms. Of course, they're always filed in 2023. And these forms report what we call minimum essential coverage. And that is the minimum type of coverage that someone would have to have under the Affordable Care Act to avoid paying an individual mandate penalty. However, the individual mandate penalty has been reduced to 0 in most states, but what hasn't been eliminated is the requirement to file the forms and to provide copies to the individuals, and of course file it all with the IRS. Now, you're subject to this if you were self-insured for 1 or more months in calendar year 2022. So for example, if you had a fully insured plan through November of 2022, but in December you moved to a self-insured platform, you have to do the reporting even though you're only going to be reporting for 1 month. The employer sends the 1095B to the responsible individual, and the 1094B along with the 1095Bs are transmitted to the IRS. So basically, just like a W-2, you're providing a form to each individual who's covered under the plan, and then you're also submitting it all to the IRS. Again, just a reference, because I do have people each year who sit through this presentation and they're already applicable large employers, or they don't have a self-insured health plan. So just be mindful of that's who we're talking to today. A proposed rule actually last year extends the reporting deadline to individuals for 30 days. And even though this rule is proposed, you can use this guidance. So you have actually up until March 2nd, 2023 to provide the statements, that's the 1095B, to individuals. But if you notice, there's no extension to file the 1094 and 1095B with the IRS. And the due date, if you're filing in paper, is February 28th. So you'd have to file it to the IRS before you would give it to the individuals. The due date for filing electronically is March 31st. And of course, only electronic filing is required for entities issuing 250 or more 1095B forms. What I like to tell clients, however, is just don't put this off. You can go ahead and do it as you normally do it, and get it done, sealed, mailed, filed, all by January 31st, but you do have some more time. So one interesting part of the law and is reporting health reimbursement arrangements. So a health reimbursement arrangement is something where the employer funds money into an account, and that employees usually on the group health plan, they can use those funds to help pay for their deductible. It's not a health savings account. So they are considered self-insured group health plans, but there's only a very, very, very limited reason why you would file for your HRA if you have one. So if you have your medical plan and an HRA, the employer only reports the self-insured coverage. They don't report the HRA. Okay, so you're just pretending that it's not even there, it's not relevant, because really you're already reporting who's covered by the plan. Now, a strange one that I've never ever seen, but it is in the rules, if you have an employee that's covered by an HRA that is sponsored by you, and a group health plan sponsored by another employer, then each employer reports, because that employee is covered by the HRA. So let me explain that. That would only happen if an employer has an HRA that reimburses expenses related to another employer's group health plan. We really don't see in groups putting HRAs in to benefit a separate group health plan. It's usually utilized for the employees, but it's in the rules, so there you have it. There is something called an individual coverage HRA that is reported for anyone covered by the individual coverage HRA. And if you haven't heard of this, this is where an employer can set money aside to help reimburse individual premiums. The real problem with this is, or the concern is, absolutely none of this money can be used towards any sort of subsidy whatsoever. So by providing this coverage, people are being blocked from receiving subsidies. And if you go in the marketplace or off the marketplace without a subsidy, the costs are very, very high. So this one seemed like it was a lot more when it first came out, but it's very limited in scope. The federal mandate, individual mandate penalty has been reduced to 0 as of 2019. So while there's no federal mandate to maintain coverage, some states have adopted or have in place an individual mandate penalty. And so here are some examples. This isn't necessarily exhaustive because there are different states looking to do different things all the time. But New Jersey, Vermont, I have penalty there because actually you're required to report you have health insurance, but there's no penalty attached to it. Washington, D.C., California, Massachusetts, and Rhode Island. And in some of these states, or in Washington, D.C., they actually use the 1094 and 1095B for that state reporting. So I guess that's why the IRS wants us to continue doing it, so that state individual mandates, they can still get the forms and they don't have to create, the state doesn't have to create a different form. So I always tell people that you can check with your payroll if you have employees in other states or in any of those states. So covered individuals, you'll generally hear when you're talking about health insurance, talking about covering your employees, right? But under this law or this rule, you're actually reporting who is covered on the plan. So that is anybody covered on the plan. So they're all covered individuals. So you're going to be reporting on the employee and the spouse and dependents if those individuals are actually covered by your plan. And then you do a little checkbox for every month covered that individual is covered, and we'll show you that in a minute. For this reporting, 1 day counts for an entire month on the 1095B. So if a baby was born on September 15th, then that you would check the month of September, that and they had coverage in September, obviously, then you would check the whole month, even though the baby wasn't born until the 15th. You do need to report with the Social Security number of each covered individuals, and oftentimes employers aren't tracking that. There are a couple of different ways the carriers or the TPAs assist you with this information. So for example, Aetna will generally file it on behalf of all their small employers. Anthem will post stuff in an employer portal, and you pull down the forms, and then it's your responsibility to file them with the IRS. National General or Allstate, they provide you with a report and a tool called Xywave, but then you still have to print and file them all the way with the IRS. Okay, so basically it's the different carriers can provide some level of assistance, but it's generally up to the employer to make sure they're distributed and filed with the IRS. So here is the 1094B, and this is the transmittal. So this is your cover sheet for all your 1095Bs. So this is just telling the IRS, this is our plan, this is the employer, and here are the 1095Bs. So you can see filer's name, employer EIN. You want to put the person's name to contact, perhaps that's you, perhaps that's somebody else. The street address, city or town, state, country, and zip. And you, on number 9, it says they want you to list the total number of forms 1095B submitted. So you usually do your 1095Bs first and your 1094B last. This is a form that is filed under penalty of perjury, so you generally want to have whoever it is in your company that files tax forms with the IRS to go ahead and sign that form and take care of that. The 1095B is the individual's statement. So this is what the individual gets to show that this individual and his or her spouse and dependents had coverage and for how many months. And it's comprised of actually 4 parts. Okay, so you've got part 1, where you're going to list the responsible individual. Now, that's usually going to be the employee, because the employee has coverage. The employee has coverage as a result of working for you. So the responsible individual isn't going to be the spouse or dependents unless they're on like state continuation or COBRA coverage. Then they could, I'm sorry, it would have to be COBRA because state continuation does not apply to self-insured plans in the state of Virginia. So it's provided to the responsible individual. You could have a family where they're covering a child that files their own taxes, but is under age 26, because the individual can still be on the group health plan. So if there's a mandate where that child is living, you can give them a copy of the form. The employer isn't required to make different copies for everyone in the family. Part 2 is what you provide certain information about the employer-sponsored coverage. And for those with self-insured plans, it's very simple, which you'll see in a minute. And part 3 is where you list the insurer or the other coverage provider. Part 3 is where you put your organization down as the coverage provider. And then part 4 is just where you list the covered individuals. You're starting with their name, middle name, last name, social security number or taxpayer identification number. You only report the date of birth if the social or taxpayer identification number is not available. But I would recommend that you get a social security number or taxpayer, TIN for every individual in the family. So the part one for the responsible individual, you can see lines 1 through 7. You have the name, first name, middle name, last name, social security number, TIN, and again, only the date of birth or social security, only the date of birth if the social or TIN is not available. Then the employee's street address or the individual's street address, city, town, state, country, and zip. Line 8 is where you're going to enter the identifying origin of the health coverage. And so there are a number of codes used for that. You can see if you happen to have a SHOP program, there aren't any SHOP plans in Virginia, so that probably wouldn't apply. Employer-sponsored coverage, that's going to be most groups, a B. You're not with the government or individual marketplace unless you're a multi-employer plan or other designated minimum essential coverage. And then the employer-sponsored coverage, that's an individual HRA. So I think by and large, most clients on the line are going to use B because you're sponsoring the coverage and it's an employer plan. So here we've gone over part 1 and now we have part 2. If you entered code B on line 8, you then skip part 2. This is only for the insurance carrier to complete. So if you enter code B, you skip part 2. And then we move to the issuer or other coverage provider. So why is that? Because they're not asking information. If the plan was fully insured, okay, you would list the employer, and then under part 3, you would list the insurance company. Well, in this case, under the law, the employer is considered the carrier of the coverage. So the employer, rather than list the employer information twice, you skip part 2 and you go to part 3. And so here is part 3, the bottom in red. That is where you're going to report as the coverage provider. So that's where you put the employer name, the employer identification, telephone number, street address, city or state, city or town, state or province, and country and zip or foreign postal code. So remember, that's where you put in your information. If you have something like a multi-employer plan or multiple employer plan, or you're a member of a controlled group, there may be a couple of different ways of completing this, and I would refer you to your instructions or your CPA. But in general, you're gonna file as the issuer or coverage provider. And we're already at part 4, and it's only 20 minutes into the hour. So part 4 is really the heart of the form, because here you're reporting all individuals covered, the employee and any family members covered for the months enrolled, and they're all going to be on the same 1095B. So, excuse me, column A, first name, middle initial, last name. Again, I know this looks familiar. Social security number or tax ID, date of birth only if you don't have the social or TIN, taxpayer ID number. And really everyone should have the social or TIN number. It can get complicated if you've got 2 Tom Smiths that were born on the same day. So you should be able to get that information. You enter the date of birth in the year, month, day format only if the TIN column is blank. And if the individual was not covered for all 12 months, then you just check each box for which the individual was covered. Because if you can see, D says covered all 12 months. So a lot of people are going to be covered for the entire calendar year. You may have hired employees during the year. Maybe you hired someone in June and they had a waiting period, and so they took coverage in August. So that's where you would check the boxes. Or you had an employee who had a baby in August, but the employee was covered for all 12 months. It is possible. These things are like W-2s. So if you had an employee who came to you and was covered starting in August, hopefully that employee had insurance coverage at their other position before they came to you, and so they would be given a 1095B or a 1095C for January through July. So every year, clients ask that I have an employee coming to me and they've got 2 of these forms. Why is that? And it probably is because they were covered under 2 different entities during the course of the year. So with that, feel free to reach out to me. And again, I really appreciate your time. And we will be doing this again in the month of December. And I hope that you all have a wonderful day and a wonderful Thanksgiving. Thank you so much. Take care.